Hey, everybody. Welcome back to the Halfway to Dead, a midlife spiritual journey podcast. So this is technically episode 17, but it's a bonus episode from episode 16. So if you haven't listened to that one, go back and check that one out too. So this is just a fun bonus episode where Dr. Tyler Lovell and I have some fun going over some different scenarios we find ourselves in as pet owners. And he kind of lets us know what we need to do. Do we need to go to the ER? Or can we just wait for our vet to open up in the morning? Okay, here we go. All right, here's what I want to do. I'm going to lighten it up just slightly because I got some rapid fires for you. Are you ready for this? I'm going to throw a scenario at you. And this is to help all of us.
Are these just random things you came up with?
Yes, this is stuff that I know to be things people might wonder about. Because another problem is don't go to the ER if you don't need to. Don't clog up the ER. Okay.
Yeah, I get so sick of seeing certain things at 2 a.m., but yeah.
No, I know. Okay, so I'm going to give you the scenario, and all you have to tell me is if this is ER or primary care.
Or urgent care. Let's do
urgent care. Well,
ER versus urgent versus primary.
Yes, but here's the problem with that. We don't all have urgent cares available to us.
But I feel like urgent cares are more available than ERs.
Well, I'm just talking from my own particular area here. We have zero urgent cares. So our only option is ER or primary care. But let's do that. Let's do that then. We'll do ER primary care. And if there is one of these where it could have been maybe urgent, you can throw that in after.
Yeah.
In the middle. But let's just say that we live remote and we're either driving to the emergency room or we're going to wait till our primary care opens or call our primary care. Okay. So just primary care, ER. You ready? Narrowed them way down, so they're real short. Listen, number one, my male cat, Phil, he hasn't peed all day, and he gets real pissy.
What is this voice you're using right now?
This is my podcast voice.
Okay, go. I know. All right. Your voice just shifted. Okay, go.
Okay, you little shit. Let me start that one again.
Your voice is like, hi, my name's Phil.
Because I was going into owner mode. This is me. I'm calling. All right.
No, I picture you like going up to I always laugh with people about like going up to the front counter. People love word vomiting at the front counter. They go up and they're like, my dog can't eat, can't walk, can't breathe. They say like everything under the sun.
Oh God. Okay. Listen, I'm going into my persona. My name's Susie and I'm the owner of an animal. Okay. Here we go.
Okay, go.
Okay. Okay. All right. Here's number one. My male cat, Phil, hasn't peed all day, and he gets real pissy when I touch his belly. It's 2 a.m.
Bring him in, ER.
ER, because this is life and death.
Things, urethral obstruction, stuff. Okay. Yep.
All right. So if your cat is not peeing for any good amount of time, especially a male, ER. Okay.
Yeah. No urination, 24 hours, bring them in.
Gotcha.
If they're non-productive straining, 12 to 24 earlier. If they're not doing well earlier.
Because that's an emergency. Okay. My dog has had drainage coming out of his ear for 3 days. It's midnight and he's scratching at his ear.
Tomorrow problem, or you're waiting hours.
Primary care. All right. Not life or death. So call as soon as your vet opens in the morning, give him a call. Okay.
But that's as a caveat to that though. That's tough for owners too, though, because like everything is so overbooked with general practice. We're like, what if you can't get an appointment? Then you're waiting hours. But I don't think you have to do that necessarily at 12 a.m. if you've been waiting 3 days.
That's what I mean.
But sometimes you end up having to wait hours anyways because you can't get in to your GP, which is reasonable.
Yeah. So we may end up having to pay more at the ER to get there anyway. And this just goes back to the whole vet shortage thing, guys.
But urgent care, if there's an urgent care, that's the option.
That would be the option.
Not an ER.
All right. Yeah. You're going to love this one. My 5-pound teacup poodle just ate 10 grapes.
5 pounds?
It's a 5-pound teacup poodle, ate 10 grapes.
Yeah, I would probably bring them in.
Okay. What about if it's my 120-pound German Shepherd and he ate 2?
Ugh, I hate talking about grapes. Grapes are like so frustrating.
Because if you Google that shit, everything's an emergency.
So here's my hot take on grapes. And I think grapes, raisins, they're really tough to Google because they scare owners.
Mm-hmm.
But I think the bottom line with grapes, raisins, we talk 1 per 10 pounds is like safe. I think there's not a ton of research to back a lot of the recommendations that poison control has that we have in general, because technically, and this is where it's a caveat to like seeking care or not, is like any dose of grapes and raisins can cause kidney damage. Is it unlikely? Absolutely. Is it possible? Yes. And so the scenario why I was like, yes, in the case of a 5-pound dog,
because they're so little,
the 8, 15, 20, like that's exceedingly high to where I'm like, okay, I'm more concerned than a 100-pound dog ingesting 2. But it's that theoretical, right? Of like, at the off chance, uncommonly, could it cause an acute kidney injury? Sure, probably unlikely. So
gotcha. I got an fender bender. Wasn't a big deal. Rear-ended someone, but my 35-pound dog was in the front seat and he hit the front dash. He's whining a little bit, but like he seems fine. What do I do?
ER.
Because we don't know what's going on. There's internal bleeding.
They can have fractures. They can have internal bleeding, bruising, all of that. So yeah, definitely.
Okay, so that's definitely ER. Even if it's just barely a little fender bender. If they were not like restrained and they hit the dash or anything, nope, you got to go straight in. Okay.
Yeah, at least for an exam.
Yeah, something.
Yeah.
All right. It is 4 a.m. and my dog pooped and I see bright red blood and I'm freaked the fuck out because it's bright red blood. It's 4 a.m.
I would say waiting until the morning. If you can get an appointment with urgent care GP is fine. If it's blowout blood, your pet's not eating, vomiting, doing really poorly, then sooner would be my...
Yeah. My 5-year-old corgi jumped off the couch and laid down and he doesn't want to get back up. Like he jumped down and he's laying there and he doesn't really want to move now. But he only jumped off the couch. It wasn't that high.
Bring him in, ER.
Okay, because...
They can have a slip disc would be my biggest thing in any long back dog, like corgis, Frenchies, dachshunds. All of those dogs are predisposed to herniate a disc from living. But any trauma, and that can be jumping off a couch or falling off the couch or falling down a stair, all of that can trigger it too. So all of those are reasons to come in.
Gotcha. Okay. How about this one? I keep noticing my dog eats a lot of grass. Do I need to come to the ER?
Definitely sounds like a GP appointment.
Okay, good. Yep. All right. How about this? My cat seemed like she's older. She's an older cat and she seemed like she was having some pain, like some arthritis pain. So I gave her 3 Tylenol at 2 a.m.
ER.
Okay, because we
say ER.
More than anything, we cannot give our cats human meds for the most part. Correct?
Dogs too, honestly. I would just say don't unless somebody
unless a vet has told you, because like I've had a vet tell me like it's okay to give Benadryl. It's okay.
Well, yeah, I think Benadryl you should have on hand if you have an allergic dog. Just to give one.
Right. But in general, we don't give our animals like Tylenol, aspirin. Like don't do it. Okay. All right. So that is an emergency room thing. Because if you gave your cat Tylenol, you better get in the car. Okay. So how about this? Here's another cat one. I just found my little cute cat Fiona eating a beautiful bouquet of lilies that my boyfriend sent me.
ER for sure.
Okay. Them damn lilies.
Yeah, kidney damage. I've seen some lily cats do really poorly. So early intervention, decontamination if you can, cleaning them. One thing, and this is one thing that I think people try to do, is like wait and Google a lot and delay time to getting there. I think the only thing that you could do is if there's pollen on their face or paws on the way there to clean it, like wipe it with water.
So they don't lick it.
Well, because you need to get all of that off. And so if that's going to delay your time to a veterinary clinic, then don't do it and just get there. But if you can do it on the way there, I think that's something technically you could be doing.
Yes. And maybe take a picture of the flowers they ate real quick with your phone before you go so they can identify.
Yeah. And that's what's frustrating is because I'm not like an expert in plants and poison control isn't either. So there's a lot of apps out there. I forget the name of a couple of them, but there's apps where you can submit.
I'm going to put them in the show notes because I have one in my phone.
Yeah. I don't remember off the top of my head, but I always tell owners to Google it really fast. The front's better at it than me in telling them. But there's an app where you can send in your picture or you can take the picture and it'll identify it for you.
Picture this.
Picture this. Yeah.
And so I'm going to put that in the show notes too because we should all have that.
And it's great to quickly say, is this, because not all lilies are toxic.
Correct. So take a picture of it. And also, just as a PSA, if you're out there and you're sending flowers to people and blah, 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 if you know your friend has cats, you need to make sure that it's a cat-friendly bouquet you order because you do not want to be the one that sends this beautiful bouquet to your best friend and kills her fucking cat for her birthday. Yeah. Okay. So pet-friendly flowers out there. There you go. There's my PSA on that. Now, let's go to this one. My dog, he's eating shit again, and now he ate half of a corn on the cob. And I'm just home. I'm thinking, I'll just wait and see if he can pass it.
No, bring him in immediately.
Corn on the cob, guys. Deadly.
Corn on the cob. I talked to this owner. She's so funny. A couple weeks ago, we ended up inducing vomiting in the dog. And she was like, I'm banning corn cobs from my home. I'll never allow one into my home again. Corn
After
cobs
that,
are
I
a
bet.
nightmare.
Yeah. No.
They're a nightmare. They don't pass. If your dog eats that, bring it in. If your dog eats a sock, if your dog eats anything
with elastic
shit,
yeah.
The important thing is when your dog eats a sock, when your dog eats these things, and it's midnight or 10 or 11, don't sit and see how your dog does, because it's going to need surgery. And all of that is
because that's not getting
important
through.
Timing to get things out of the stomach. But if you sit on it and the story turns from my dog ate a sock 3 hours ago to my dog ate a sock 14 hours ago and is vomiting. Now we're talking about inducing vomiting out the door, $500 to 10 to 15
Things
for major surgery.
Yeah. Yeah. The prognosis gets more poor and your bill goes up.
And you're putting, your bill goes up, you're putting your dog through major surgery. Like it's just a lose-lose. So.
Yep. Let's not do that. Okay. How about this? My male cat keeps backing up to our front door, and then I see his tail shaking kind of weird. And then the whole fucking room smells terrible. What do I do? Do I need to go to the ER?
Yeah, it sounds like spraying, marking behavior.
Not an emergency. That's more behavioral.
No,
Gotcha.
Definitely not.
Definitely not. Okay, keep your butt home. Okay, here's a good one. All right, it is 3 a.m. Here's the scenario. It's 3 a.m. and I'm having a bomb-ass party at my house. Okay? I look over and I notice that my cat is licking a line of cocaine. My 60-pound dog just ate a bag of my weed gummies, and my 20-pound dog might have gotten a little meth. What do we do?
Sounds like a party at the vet.
So all three of those really need to fucking come in.
To me.
Because will they die? Maybe not. But they could, right? They could suffer at the very least. Yeah.
The important thing is definitely things can go poorly. When we talk about like marijuana ingestion, which I see literally nonstop, is that when they get really, really high doses, they can get so sedated that they can lose gag, like they can lose their gag reflex and need intubated because they're so inappropriate. And so those are the pets that do poorly because they aspirate, vomit, and they just don't have a secure airway. So those are the scenarios I've seen with dogs that are just high on marijuana do poorly, but I would say the wide majority of marijuana cases do fine. It's more when they get really, really high doses or really, really high. Which is usually not
probably like eating one like rolled joint. These are dogs that are getting into edibles for the most part, like high dose edibles.
Edibles are where it gets really, edibles is where it gets really bad.
Yes, because you've got high doses that last a long time.
I've seen it get really bad with dogs eating joints and stuff, and they're little, and even if they're not little, like, I don't know, it's tough. There's not a ton of like dosage things about weed, and every dog reacts a little bit different. So
in general, if your animals, dog or cat, because do you get a lot of cats that come in or no? It's more dogs, I'm sure. But do you
never. I literally never get cats that are high.
Are they just like
cats are less dumb than dogs to get into that way. Cats don't eat stupid shit as often.
Cats are looking around the room like, these people are ridiculous. These are idiots. I want nothing to do with it.
I would say that cats don't eat dumb shit as often, but when they do, it's bad because cats don't pass foreign bodies very well.
Okay.
Like dogs can pass a lot of foreign material, foreign bodies decently, but cats just don't.
Okay. So it doesn't happen as often, but when they do ingest something, you got to get there. You got to get to the
Cats eat like sewing needles and eating like coins, just weird shit that you wouldn't think.
Okay. And dogs kind of get into everything. So at a drug party, it's our dogs that are at high risk, not so much the cats. Okay.
Yeah. I haven't seen like on drug cats very much at all.
Yeah. I would think it'd just be like if they were sniffing around, checking out some cocaine or something.
It's more people giving cats medications they shouldn't.
Yeah, like the Tylenol and stuff. Yep. Yeah. Thought you were helping your arthritic cat and now it's dying. Okay. I'm just saying, not great. All right. Here's what I got. My 5-year-old male English pointer, his belly is like huge. He looks like he's pregnant. and he didn't look like that yesterday. So it's not a weight problem. He's not fat, but now his stomach is kind of blown up.
Well, people always say stomach is blown up when they mean abdomen's blown up. So I think the question is
I'm doing this in layman's terms.
Yeah. So I think the question then is like, is the stomach truly enlarged? I think, is it like a food bloat? So just a really distended stomach, or is it like a twisted stomach or a GDV is probably what you're talking about, which is totally different scenarios.
So in general, though, if we notice...
I would say if you're worried and your dog has a bloated stomach, sure, you can bring them in to be evaluated and go from there.
Just in case. Okay.
If your dog has a bloated stomach and it's gagging nonstop, not able to move, seems painful, those are big red flags to bring your dog in.
So go in for sure. Okay. How about this? My sweet little cat Fluffy is breathing with her mouth open and seems a little bit stressed. She doesn't usually breathe with her mouth open, but she's breathing with her mouth open.
Yeah, ER visit for sure. Respiratory distress.
Because cats don't breathe with their mouth open unless...
No, you'll see some cats with like upper respiratory infections that will breathe through their mouth because they have so much congestion. But I would say as a rule of thumb, for owners at home, if there's open mouth breathing, you should bring your pet in.
You should bring your pet in, for sure. All right. My dog's right eye is swollen shut. There's no discharge. It's been like this for 2 days. And, you know, I'm just up binging my favorite show at midnight. And should I just go get this taken care of at the ER, or can I wait till morning? It's been 2 days. Eye is swollen shut.
Yeah, I would say it can probably wait until the morning. The caveat to that is like, was there trauma to the eye? Is the dog painful, or is it truly just like a conjunctivitis eye infection?
Like if he's just sleeping and chill with a swollen eye, you're probably okay. If he's not like crying and whining, like you can maybe wait till morning.
Or known trauma to the eye, things like that.
Well, yeah, obviously if you know something happened.
But I think if you're that worried, bring your dog in, because I think also people can rationalize their pet not doing well very well.
Oh, yeah.
So
minimize it.
And with eye stuff, like sometimes they can be uncomfortable. You don't know they can have glaucoma and have a compromised eye that immediate treatment's necessary for. So I would say if you're on the fence, just bring them in as an all-encompassing thing. Because I also don't want people downplaying things. That's what people love to do with every problem.
Right. All right. So what if my dog feels kind of hot and I took his temperature with my human thermometer? Okay. So I think he feels hot. And I'm like, I'm going to take my dog's temp. So I just get my human digital little thermometer. I stick it in his little butt and I get a temperature readout of 101. Does he have a fever?
Normal.
Yeah. 101 is normal. Because do we add or subtract? What do we do to figure out if our dog has a fever or not with our human thermometer? How do we do it?
A human thermometer should work too. The same. It should be below 102.5. It should be normal. A lot of times people will, if you get like an ear temp, will add one for a rectal, but that's not like set in stone. But I would say if you're that worried that you're getting a temperature on your dog, you should probably bring it in. And I think the more important thing is like, are we eating? Are we breathing okay? Like other things.
Right. So if it's during the day, definitely call your primary care first.
Yeah. I mean, you don't need to run in. If your pet's eating, breathing comfortably and has a 101.
Yeah. And you're just having like a little bit of a panic attack that you think your dog feels warm. Like you can probably wait till morning if nothing else is going on.
People always think the amount of people I say, well, she feels warm and they don't have a fever is a ton.
Yeah. So just wait on that. Are there any other things on animals that we could like look at to assess? Because mostly you guys are going to want to know, like, are they eating and drinking? Is there any vomiting? When was the last time they passed their stools? Like, these are the things we need to know, right? And then is there anything else we could assess to know if it's like ER worthy or not? Because we don't really know how to look at the color of their gums.
I mean, you can. I think you can also learn how to get respiratory rates. Like a lot of our respiratory patients, heart failure dogs, things like that, we actually teach them.
Yeah, if it's a chronic condition, you're going to know more about it anyway.
Yeah, like how to say, okay, the respiratory rate's over 40 consistently, I should get reevaluated, and or respiratory effort, like breathing with the belly versus like just breathing in and out.
Yeah.
More than normal.
Yeah.
But if there's any amount of respiratory distress, that's like an automatic, you should bring your pet in. And a lot of people don't even know what that looks like. So open mouth breathing.
It's tricky, yeah.
Breathing with the belly, things like that. Okay. Obviously, the obvious things are like collapsing events, things like that. But then again, I say obvious and I have people their pet goes into respiratory distress. And I've had this weird influx of people that want to submerge their dog in water when it's in respiratory distress. Yeah. So I've had like...
Was this on TikTok or something? What do you mean?
No. I get a lot of cases like this, and it happens a lot in veterinary medicine.
People see their dog having trouble breathing and they put them in water? Like in a bath? What are you saying?
Yeah, this dog I saw a few weeks ago was in respiratory distress. So they submerged it in water to get it clean and then did compressions on it, I guess, for like 30 seconds.
To get it clean?
People love to clean their pet when they're not doing well. Like the amount of dogs that come in wet, and I'm like, why is it wet? And they try to bathe the dog to see if it'll feel better.
That's a thing? I've never heard that.
It's super common. Yeah.
Because if my dog's sick, the last thing I am thinking about is like, is he clean? Does he need a bath?
I mean, I also would think the last thing you would think if your pet was in respiratory distress would be to put it in water.
And make it cold.
But people do that. Well, no, people submerge the dog. Like they put the dog all the way underwater.
Thinking that'll like, take pressure off their lungs?
Because they thought the dog was just having anxiety and that it would calm the dog down. So they put it underwater.
Oh, they're mistaking it for an anxiety attack. Okay, I'm still not understanding. I'm still understanding because if my dog's having an anxiety attack, I wouldn't think to like stress him out more and put him in a fucking tub of water.
I don't know. I tell all those owners, don't ever submerge your dog again. Don't do compressions at home. The dog wasn't even dead. The dog wasn't even dead, and they were doing compressions, which is just unwanted trauma to your dog.
Yeah, let's let the professionals do It's not like humans where you have to start CPR that second, especially if you don't know what the hell you're doing.
I think that the wide majority of people with pets aren't going to know how to appropriately do CPR, and they don't have the equipment or the drugs to adequately perform CPR. And without tangenting into a whole CPR conversation, the prognosis for dogs, regardless of why they die, is less than 5% of leaving the hospital. And that's wildly different compared to human medicine statistics.
Yeah.
There's obviously a lot better prognosis for anesthetic or drug related under anesthesia deaths. Like we get a lot of those patients back, but anything presenting to the ER dead, less than 5%. So if you're going to delay time to arrival to do some variation of what you think makes sense, is probably not appropriate.
No. Okay. And so are there any other things we should keep at home? Okay, because you got me thinking. Because there's so many animals that like ingest weird shit, or you're just not sure. Is it worth what we see online where you can buy like the charcoal, buy something to make your dog start vomiting?
I don't really love it. I don't love it because people do it really poorly.
Okay.
So people will do hydrogen peroxide poorly. It won't work, or they'll just cause really bad esophagitis. And all of that time that you're Googling things, coming up with your own thing that doesn't work, you're delaying time to presentation and time to decontamination. So my thing is always, if you're on the fence, call poison control and follow their recommendations. But I think sometimes poison control will recommend inducing vomiting at home.
Okay.
Poison control's recommendations doesn't have to be mine, and it doesn't have to be other vets' recommendations. Like a lot of times, there's times when we have differing opinions. I would say, obviously, it depends on the toxin scenario, the time it's going to take them to get to a vet, things like that. But I would say the wide majority of time people do it inappropriately or wrong, or it doesn't work, and they end up trying and coming after the fact. But I would say,
so we don't want to delay these things by trying all our
I would
DIY
say if you're that worried, you
stuff.
should just bring your pet in. You should just bring your pet in.
Yeah.
Because we usually prioritize vomiting patients that have a high concern for life-threatening scenarios pretty quickly when we get there. And then we can talk to poison control too. If poison control is recommending that you induce vomiting, that probably means they're also recommending that you seek care because there's concern.
Oh, God. So, they're not just going to tell you to make your animal vomit and then chill at home. Like, you still got to get there. You still got to get there. What if our ER is like an hour and a half away? Does that change?
Then I think it's worth a try, but it depends on what it is, right? Depends on the dose, what the medication.
Yeah, so just call poison control and
I think step one is calling before you Google it out and do whatever you think you need to do.
I think we spend way too much time on Google.
Yeah.
To get a bunch of crazy opinions.
Yeah. And granted, I think poison control gets a lot more aggressive in terms of recommendations for grapes and raisins than I ever do.
Yeah.
But still, I think there is
I was in this scenario, everybody. And just so you know, I did find there is online a calculator where you put in the weight of your dog and how many grapes or raisins, and it will tell you if it's toxic or not. All right.
Or just memorize. 1 grape or raisin per 10 pounds is your rule of thumb at home. So know how many pounds your dog is.
Yeah,
That'll calm your anxiety.
That'll calm your anxiety. If it's a little tiny dog and they get a hold of anything, I don't know, you just better head in because those little tiny dogs. Yeah.
If you have a little Chihuahua and it had more than 2 grapes, you're already there. So yeah.
So head in. Yeah.
Okay.
Or raisins. In my case, it was raisins that they got a hold of, but which, for everybody out there, same thing, grapes and raisins. So anyway, basically what I'm hearing throughout all of this is if you're not sure, the safest bet is to take your pet to the emergency room or urgent care if you have one, to the emergency room. But you're going to need to you're going to need to practice some patience because if you get to the ER and it isn't as bad as you thought, you need to stop and remember that's a good thing. That's a good thing. It's not as bad as you thought it could have been. And you might be waiting a couple hours and that's nobody's fault. Okay. And you're going to get taken care of and your dog or your cat or whatever is going to be fine. But we're going to need to have some patience.
Because if I think your dog needs to vomit the second it gets there, which sometimes I do think that, then I talk to you immediately. But another pet peeve I have, I will never just induce vomiting in your dog or cat without talking to you first. And so I think people have this, like we talked about, either I did things before I talked to them and they're mad about that, or I didn't and they're mad about that. So there's no winning either way. But I walk into so many rooms and they're like, I assume you already induced vomiting. And I'm like, no, you assumed wrong.
Right. I'm going to talk to you first.
Inducing vomiting is not a benign thing. There's risks. The risks are rare, but they're life-threatening risks. So I never induce vomiting without talking to an owner first. So that's just something to know.
Yes. But what I'm saying is, if your dog needs to have induced vomiting, because you're going to tell you're going to be honest, right? We're going to be honest when we get there with the front desk and we're going to tell them what they ingested or what's going on. And then they're going to base, because we were honest with them, they're going to base how quickly we need to be seen. So if your dog needs to vomit fairly soon, they aren't going to leave you sitting there for 2 hours. All right. They're going to get your dog vomiting if he needs to vomit. They're going to talk to you. Like, again, patience, everybody, patience. And we got to let people do their jobs. And we're just going to be honest.
There's very few toxicities where people love acting really wild, like time is of the essence. And it's like, okay, well, whether I induce vomiting now or 20 minutes or 30 minutes from now, it wouldn't matter.
Right. So we just have to trust that you guys know.
Stop freaking out up front and acting like a production. That's what people love to do.
Yes.
And it's always, and there's some weird thing in the water. When pets are really sick, a lot of times owners are less worried, but they have 1 grape and the owner's a 10 out of 10 psycho in the lobby. And they're more worried than anyone else.
Yes, because
like it's so.
Yeah, we can have an animal that's very, very sick and we're able to say like, oh no, well, I mean like, well, he's still eating. Like, and then we think everything's fine because they still ate.
Or he's not. And people are like, well, he ate 4 days ago. It's like, oh
shit. Yeah. Like that's a red flag, but we'll justify like, oh, I think his stomach just needed a rest for 4 days. Right.
Or he's always like that. He's always been a picky eater. Well, dogs don't just not eat for days.
So. For days. Yeah. That's a red flag versus like, yeah, they ate 1 grape or there's a little bit of an ear infection starting and we're flipping the shit out. That why isn't my dog being taken care of right the fuck now? Okay, everybody. I hope some of these scenarios helped you. And again, let's thank Tyler for taking his time to explain things from his perspective. And I hope that you guys learned something. This has been really fun. And I can't wait to continue our journey on the next episode. Don't you worry. We're going to be getting woo-woo again real soon. See you guys. Listen, I know your time is valuable. And right now I'm feeling super grateful and totally humbled that you chose to hang out with me today. If this podcast resonates with you, could you do me a solid and hit that subscribe or follow button? That's going to help you out because you're never going to miss an episode. And it helps me out because you're never going to miss an episode. And if you have like 30 seconds more, could you leave a 5-star rating and maybe leave a kick-ass review? Thank you so much. And I can't wait to continue our journey on the next episode. Oh, and I can't forget the fine print. You know, the legal jargon. This podcast is presented solely for educational and entertainment purposes. We're just 2 friends on this journey together, and this podcast is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or any other qualified professional. You get it. See you next time.